Yes, got it. Imposter syndrome. What is it and how to manage it? We will also talk about it a bit, how academia settings benefit from us having imposter syndrome. So just shortly about myself, I prefer to be called Oля. My official name is Olga Vvedenskaya. I have obtained my MD in 2012 from Moscow, and my PhD from Humboldt University of Berlin in 2017. Both of it was devoted to medical application, so mass spectrometry application to medicine. I have just finished my postdoc in Dresden, and I started as a manager in industry a couple of months ago. And I'm one of the organizers of mental health initiative in CBG in our institute in Dresden. Then I'm also one of the organizers of the Mental Health Collective of Max Planck Society, the organizers of today's talk and the whole week of amazing talks, actually. And I'm also a Dragonfly Mental Health co-founder and chief administration officer. So Dragonfly Mental Health is a nonprofit organization which is also focuses on academic mental health, and we're just doing similar things as what Max Planck, Mental Health Collective of Max Planck Society does, just on a global scale. Now and later on, if you want to ask me a question, or tomorrow, if you wake up and think, oh, I could have asked something, just please feel free to reach out to dragonflymentalhealth.org. You can find me there. You can write to my MPI email. All these things are pretty easily Googleable. So just reach me out to any channel, to me through any channel, and then I'll be happy to stay in touch. Yes, as already Barbara mentioned, we're all here are not healthcare providers. So the information provided today doesn't qualify as medical advice and does not substitute for speaking to a medical professional. Today's talk is educational talk. Imposter syndrome, what is it? It's also, so basically, since this imposter syndrome is not a recognized psychiatric disorder yet, some people tend not to call it a syndrome, but they call it imposter phenomenon or imposter experience or fraud symptom or perceived fraudulence. Basically describes a high-achieving individual who, despite their objective success, fails to internalize their accomplishments and has persistent self-doubt and fear of being exposed as a fraud or imposter. First time it was described in 1978, and there have been a couple of other studies which we're going to talk about today. According to some publications, there are around 30% of medical and pharmacy students have imposter syndrome, and up to 60% of physicians and physicians in training experience imposter syndrome. In this systematic review from the last year, we see that depending on how to screen for imposter syndrome and how to apply the cutoff tools, up to 80% of people have a tendency to have an imposter syndrome, and it's common among both men and women across a range of age groups, from adolescents to late-stage professionals, often comorbid with depression and anxiety, and is associated with the impaired job performance, job satisfaction, and burnout among various employee population, including clinicians. So far, there is no published studies evaluated treatments for this particular imposter syndrome in academics, and we'll talk about why it is this way a bit later today. What I wanted to discuss with you is actually, you cannot call them symptoms of imposter syndrome, but rather I'd call them imposter syndrome experiences in academia. So numerous diplomas, assurances of colleagues in your professionalism, high position, and praise from your bosses, and you still do not believe in your merits. You believe that all you have achieved is through a happy coincidence of circumstances and not at the expense of your own talent, qualification, or efforts. You may feel like you're driving others around, that you're lying to them, and you don't really understand what your work is about. And while imposter syndrome is not a medical diagnosis as any other anxiety or neurosis, it can still significantly ruin your life. You may also experience the feeling that whatever you can do is constantly negatively evaluated, and that wherever you find yourself at some particular point, it's all just by accident. Something which one may think is, when they find out the truth about me, they will definitely give up on me. And it goes along the story of this naked king when the king was lied by the servants that the king has the best dress, but in fact the king was naked, and like he didn't even realize it till a certain point. So people with the imposter syndrome, they believe that they are this naked king, that they don't have anything to show, and they're just like, pretending that they have something. So, and this kind of thought, I'm here by accident, I have nothing to show, it is also followed up by a fear of revelation, and it leads to a constant feeling of shame. So like one may think, oh, people will see that I am that naked king. And then, so of course, essentially the self-esteem of these people, of people suffering from imposter syndrome, depends on their achievements. So in our cases, an academic achievements, and not just the successful experiment, but rather on the achievements which one has to demonstrate. For example, publish a paper. So therefore, the self-esteem of people suffering from imposter syndrome is not fixed. And it's like sort of fluctuating, right? And the people with imposter syndrome, they feel like they achieve something and therefore they have the right to be. Other things which one may express or experience is, for example, giving too much credit to others and not enough for yourself. Something like, I could do nothing without the support of my postdoc, right? It's not true for most of the cases, actually, probably for all the cases, or for the vast majority of cases, but still, we still tend to give people credit, whether they deserve it or not, but like, I'm nothing without my postdoc is really not something nice to say to yourself. What one do not really have a tendency to see is that what are their own achievements. Another thing is minimizing language. So it can come from self and from others. For example, our thought of properly trained monkey can do a PhD usually comes from us being told that a properly trained monkey can do a PhD, right? Or like when your supervisor at the meeting tells you something like that all you have achieved since our last meeting. So all these minimizing languages, they, of course, they increase our self-doubt. Where the imposter syndrome is coming from is a big, huge philosophical question, right? So there are a couple of theories. None of them are probably exclusive, and all the aspects may come one with another. So for example, it can be environmental or institutionalized discrimination, which we'll cover up a bit later on, then personality traits like the anxiety or neuroticism, and some childhood and attitude experiences. For example, if we talk about trauma from the childhood, is that the child's value is determined not just by the fact of their existence, but through the prism of their achievements or lack of the achievements. And here I would like to really underline that this trauma does not have to come from the family. It may come from the primary school, secondary school, high school, or the university, or any other environmental factor where there are a group of people. And basically it means that at the moment of its development, the child was perceived by significant as an object of their own achievement, or as an object that must constantly demonstrate this achievement. So for example, the child is noticed only when they did something and it is positively evaluated. So for example, they brought an A, won a contest, earned $1 million. Or the child is constantly devalued by adults and gets used to living in a world where they're constantly in the shadows, where their achievements go unnoticed. This is also something which eventually may lead to an imposter syndrome. So in both of these cases, the child's basic value of being loved unconditionally is ignored. So basically no one tells this child, it's great you are with us and that you just exist. And in the end, person grows up with the feeling that they have to reach as much as possible to be seen or loved. And so for example, one parent may say to a child, oh, this is nice drawing, you drew in a good technique, and we'll send you to the best drawing school and all the talented kids go there. So then you'll become a fancy artist and you'll become famous, right? Or another approach is to say something like, did you like to draw? Did you enjoy drawing? How pleasant I am that you have time and desire to draw and we can do it together. So this is something, one of the things to think about with regards of where the imposter syndrome is coming from. More relevant to us, imposter syndrome in academia is that it is estimated that 20% of university students suffer from imposter syndrome, while in other publications, I think actually maybe even this year, I don't remember, that up to 95% of females experience moderate or severe symptoms of imposter syndrome. And it's a big thing in academia. And academia does benefit from us having imposter syndrome by us trying to fight this imposter syndrome with crazy overworking, with crazy working hours, with constant comparison of academic achievements, which starts from, in most cases, starts from schools and then universities. So, and one may feel like, oh, I used to have the best grades in school and now I'm the most stupid person in uni. For example, this thought, like this academic achievements, the lack of them in the university may actually trigger the imposter syndrome. Another thing which is constantly promoted by academia is a constant comparison of research achievements. So for example, you are a fresh PhD student, you come to the lab and then you see that all your peers are have already published so much, and or 4 years after you're done with your PhD paper is still not published, which is my case. My postdoc paper got published in front of my PhD paper. So this is a valid reason for me to have an imposter syndrome already. Or when our supervisors are telling us that all my PhD students have to graduate with the top journal paper. And we all know that it's not only about efforts put, it's about theory, it's about support, it's about luck after all. Yeah, but it really has nothing to do with your actual sufficiency as a scientist. But still, this academic settings, they impose these limitations to us. My favorite one is the constant comparison of efforts put. When we're told that all my other PhD students work during weekends and you don't. This is something which makes us think that, oh my God, I'm a bad PhD student, I'm a bad scientist, I'm not motivated enough, I don't love science enough to work on Saturday and Sunday, and preferentially overnight from Saturday to Sunday. Another thing which also happened to me, for example, is a sudden unsuccessful event on the academic path can also trigger the imposter syndrome. So for example, things were fine, but I got destroyed by supervisors during my defense and I barely passed. And like I'm worthless, and I worth nothing as a scientist. Another thing is financial instability compared to the peers who do not choose academic path or who are like, how do you call it? Hereditary academics. So basically the financial instability which comes from your background or from whatever reason can also trigger the imposter syndrome. And how often do we hear that from our parents that, oh, your former classmates are married and providing for their family and you're 32 and still don't have a PhD. Like this is something which also can trigger a PhD imposter syndrome. And so if you evaluate yourself through achievements, and the problem is that in academia, this is the success criteria, H index, impact factor, number of publication, number of this, number of that. So this is the success criteria in academia. And so if you evaluate your own value in your own eyes through the achievements, then you will feel like you don't have a solid fundament. So because you will fail during PhD, failure is the part of the job. This is unavoidable that some experiments will go wrong, some codes will not work, it's a long-term project, and like all these failures will knock you off from your feet horribly if you don't have this solid self-esteem, so solid fundament for your of your own well-being. And also I wanted to talk a little bit about the diversity of experiences and how imposter syndrome is more common in marginalized groups of people. So it's environmental and institutionalized discrimination, and that imposter syndrome actually threatens the diversity and may explain the higher dropout rate among marginalized groups in academia. So for example, women are told, oh my God, you're too pretty to be a scientist, or people of color like constantly being interrogated by the campus police or thought that they're janitorial staff. yeah, or like LGBTQ plus folks are always told that, I'm not even speaking about marginalization, homophobia, and racism. I'm talking about microaggressions. So like, I don't know, your outfit is not appropriate. Yeah, or for example, I know a fellow who wanted to perform the transition, uh, gender transition, but was afraid that the PhD defense community will not accept their choice. So they were postponing their transition until after the defense, which is a horrible drama and tragedy for a person. And this, of course, should not exist. But this is the experience LGBTQ plus folks deal with on a daily basis. Then the economic challenges for first generation scientists we have discussed already. And of course, disability and disabled folks, they constantly face with ableism and like struggling with the accessibility and are often told something like, oh, we only have one person with the visual impairments, or we only have one person with a hearing impairment, so why do we have to adjust the whole system for one person? So this is a horrible discrimination. Of course, it should not exist, but it still exists, unfortunately. And of course, another marginalized group is the international scientists, where they deal with the language barriers, cultural differences, and of course, we see a lot of it in Germany when the international scientists are trying to look for medical help. And while in a lot of cases one can go to ER, for example, trying to find a psychotherapist covered by public healthcare insurance is a very challenging task. It's still possible, and like we're trying to help all the folks in MPG to deal with it, actually globally as well, but it is still challenging. And so what eventually this leads to is that the person with the imposter syndrome, they live with a constant background anxiety. And yeah, and if you look closer, it will turn out that it's a fear and shame, but this fear of being exposed and the shame of not being in your place, of the shame of not of taking somebody else's place, for example. And the imposter, so-called imposter, always has the feeling that everyone else knows how to live, but the imposter does not. And so the imposter only has to pretend. And well, they're really good at communication with their lives, smiling, talking to people, and you know, sort of like feeling they still have the feeling that they lack some important knowledge or skill, and they fear that when it becomes too clear to others, then something terrible will happen. I'm sorry. And what is this terrible thing which may happen? Actually, this terrible thing is the fear of exile. Yeah, so it is especially impactful for immigrants. The fear that I'll have to go back home without a degree after my contract gets terminated, after my PhD supervisor figures out that I don't know shit. So this is something which we all deal with, struggling with the imposter syndrome, unfortunately. And such anxiety can disguise itself in other symptoms, such as great fatigue, turn into procrastination or substance abuse. And another thing which we experience with the imposter syndrome is that we have a constant desire to receive the confirmation that the person that we have the right to be where we are, and that we have the right to have what we have. And so this desire, it has to be constantly supported by someone outside. And of course, this is super challenging because instead of thinking, I'm fine, I'm a normal person who has different days, we believe that if I become perfect, no one will be able to pick on me. And then like people will kind of feed my self-esteem from the outside and tell me that they support me, and they sort of like feel that I'm great scientist. The problem with this approach is that such an assessment will never be saturated. So it does temporarily relieve the anxiety, that's true. But, and I can guarantee that most of you here who identify themselves, who can identify themselves with people have an imposter syndrome, know this feeling, is that your boss tells you, great job, you did an amazing job. And then for 20 minutes, you feel excited and you're happy. And then this still self-doubt goes back to you and they're like, oh my God, maybe they're just, you know, Maybe they're just say it because they feel sorry for me, or maybe because I tricked them well, or maybe they want to distract me. And in fact, they're already looking for someone to substitute me. So all these things, they actually come from this belief that one can become ideal, right? It's not true, or at least that's what I was told, and I'm trying to convince myself still. But the problem of the danger of the imposter syndrome, as we have already discussed, is that it drastically reduces the quality of life. And the person's life is not as pleasant and full as it could be when one doesn't have an imposter syndrome. And so there was a study where the folks, the doctoral trainees were asked what contributes the most to their imposter syndrome, and they were PhD students in STEM, and they said that they lack progress in public recognition, that they're comparing oneself from others with others, sorry, and that they also feel like they lack some skills development, for example, public speaking and scientific writing. And the application of their knowledge is missing, and they don't know how to ask for help. So all these things are contributing to their imposter syndrome. And what is interesting is that students of all stages, independent whether it was the first or the sixth year, felt like the imposters. Now, what to do? This is a challenging question, and I wish I will have an easy answer to this. Unfortunately, I do not have an easy answer to this. First thing, which is really helping tremendously, is to notice and accept the fact that you have an imposter syndrome, and the imposter syndrome is tricking you to make you believe that you don't belong or that you're not good enough. But it's just the brain tricks, the disease tricking you. Fighting, per se, fighting imposter syndrome is considered to be non-productive because fighting imposter syndrome would be equal to improving a person. So you decide to yourself, I'm not good enough because I'm not good enough because I have an imposter syndrome. Since I have an imposter syndrome and I'm not good enough, I need to fight it. And this is like a vicious circle. This is the loop you'll find yourself in. Because you already have a suspicion that you're not good enough. So it's like trying to fight imposter syndrome is not something which is recommended. What is recommended is psychotherapy. So it's not even like so-called Gestalt therapy. The psychotherapy which is recommended here is long-term and sort of non-linear iterative is suggested. And I would also try to sort of warn you about the coaching for, there are some coaching programs which suggest that they can help you to fight the imposter syndrome through some coaching sessions. And I would be also very careful about it because, again, it unfortunately can bring you to the vicious circle of I'll learn something new and then I'll become better. And this is not how you deal with the imposter syndrome properly. It's the same trap of I'm not good enough and I have to learn something extra. So whenever you're trying to learn something, you really should try to evaluate what is your reason to learn, whether you want to just become a better person or whether it's something of your interest. So for example, if you think that you want to learn, I want to learn how to write grants, just be careful so it wouldn't turn into something like a meaningless perfectionism or striving to prove something to someone. For example, if you want to learn how to write grants, this is okay, but if you think something like, if I don't write perfect grants, I will not be considered as good as a person or as a scientist. So I'll go and learn now. And it doesn't matter that I really love teaching students and I really hate writing grants. So be careful with this and try to be understanding and really careful for yourself when it comes to such things. Essentially, the treatment of imposter syndrome main approaches, they are aiming to meet the person's personality. So the person meets their own personality, which they not always have had a chance to meet during their overachieving youth. So the patient learns how to identify their own feelings. So first is the person tries to learn and defining their own emotions, then identifying the needs behind these emotions, and then finally then one can reach out to the orientation, what exactly they want to do. Another, and all the things which I have talked about, they're more like a long-term commitment, which I absolutely strongly encourage everyone to do. This is something which is really worth it, in my opinion. But in the short term, what you can do is to connect with your peers, because as I have shown you from the statistics, there is a very high chance that a woman sitting next to you has an imposter syndrome. So I'd recommend you to reach out to people whom you do not believe they're imposters. Most likely they still feel that they are imposters, but like it was really helpful for me, for example, when I have discussed it with my colleagues, and I'm a medical doctor by education, and I spent the last 4 years in the analytical chemistry lab, the hardcore mass spec guys. And when we had similar training, I told them, like, I constantly feel like I'm an imposter because you guys know all so much, and this is absolutely like crazy how much you know, and like I don't know shit. And so what they said were that, well, we maybe know more than you in mass spec, but you take care of all many other things which we don't do. For example, talking to medical doctors and coordinating all the medical projects we're doing. So this is something which second, I believe, is and should be promoted by the team leads. So this is something which team leads should tell their teams, that everyone brings something to their table. And especially when it comes to multidisciplinary teams, this is something that's essential when it brings to their own expertise to the large projects and multidisciplinary projects. I would also recommend you to try to use the principle of sufficiency, which is opposite to the principle of ideality. So the feeling of sufficiency is an important thing that may gradually, eventually heal the imposter syndrome, or like even hopefully completely replace it. So one may think something like, I can be sufficient to do my job. Of course, I'll get some skills. Of course, I'll have some skills, and some I already have. Some I will lose, and some I will never get. Somewhere I'll sing, somewhere I'll do better than others. So this is the principle of sufficiency, and it does really help to deal with all this intrusive imposter syndrome thoughts. This is my final slide. The ways to cope with the imposter syndrome, just sort of to underline what things can be done are the to know the signs and symptoms which we have discussed today, and to know that you're not alone, and most likely 95% of people around you are struggling with the imposter syndrome. Recognize that you have earned your position, and try to stop comparing yourself to others. Essentially also is to learn how to accept congratulations on their own achievements. This is also something we in academia are struggling with. I also strongly encourage you to learn how to approach and deal with your perfectionism. Try to be kind to yourself. This is essential. Track your success, even if it's a small success, in your opinion. Yeah, it will be amazing for you 2 years later to go through all the small successes you have and see how much you've grown so far. Talk to your mentor and PI if you trust them. This is something where this is something where they may support you if you feel like you trust them. Or talk to your peers. Try therapy out. I strongly encourage that, and embrace the feeling. Because of the imposter syndrome, you are where you are now, right? So with this, I'd like to finish my talk, and I'm happy to answer the questions if you have any.